grasp of how you place your hands and everything, then you can use it. For obvious reasons, in some cases, it may be a little bit more challenging to use it than others, like this conversation that was going on just a few minutes ago. So, you know, for your women, you may selectively choose when you use your gait belts, okay, your mobilization belts. The padding is nice. I had you guys, if gait belts are available when you don't have a true mobilization belt, this just pads the area, makes it a little bit more comfortable for the patient. But essentially, all it is just a seat belt. So you learn how to make what you need work. All right, thanks, Chris. Okay, so we talked about the shoulder. What's the loose pack position?
30 degrees, horizontal.
55
degrees of ABD, right? Right, so you're trying to accomplish the ABD and horizontal AD at the same time, right? And what's the internal external rotation? Neutral? Right? So it's somewhere around here. Now what you can do, I oftentimes just let them rest here, but you probably have a little bit more than neutral rotation here, right? So neutral rotation is about right here. So what you can do is take a pillow or something and just rest it on the belly. So we're guessing where 50 is or so, right? 90 is here, right? So somewhere slightly off of that is where you're going to land for your ab. And your horizontal ab is just going to, it's going to land itself up once you put it in 50 degrees of ABD. You had a puzzled look on your face. Cool? All right, so do you mind if I rest this one down? All right. So something like this. You want to make sure whatever you use, it's not uncomfortable for the patient and it's not in your way. Okay, so remember we talked about the glenoid fossa and how it has an anterior, kind of somewhat lateral disposition, right? And the humerus being the opposite of that. So your direction of force, if you're doing an anterior glide, has to be anterior and medial, where your posterior glide has to be posterior and lateral based on the orientation of the humerus with respect to the glenoid fossa. Okay? So when you come in, you're not going to do a direct posterior force. You're going to have to come from here and go that way. Now you have to stabilize by basically wrapping around the clavicle and the scapula. That's your stabilizer. So you basically want to kind of grip them with a big hand, not with the bony hand. That makes the patient a little bit more comfortable. And you almost have to be a little bit over to make sure your force is going in the direction of the treatment plane for the shoulder. And so you come in, and remember grade 1 is just barely taking up the slack. Grade 2 goes a little bit further and back up to the very beginning. Grade 3, you're taking it to the bottom and coming back to 2, which you start sensing a little bit more. Feel the resistance and back off up to 2. Grade 4, you're at the bottom. And then you just take off very little bit of slack. Okay? And again, my force is posterior lateral. Okay? That's the posterior glide. Now, an anterior glide, it's a little bit more challenging. It can be done in supine or it can be done in prone. Most people, I do it in supine. If it doesn't work, I put them in prone. You get better leverage in prone than you do in supine. But for convenience of patients, time, and ease, it's just easier to get it in supine. Okay? All right. Again, stabilizing force. Clavicle, scapula. wrap humerus and anterior medial course. Four. One is back here. There it is. 4. Reaching the anatomical barrier, backing off slightly. That's your great. So she needs more range of motion. She has very little pain. She's going to be graded, and I'm going to mobilize her in grades 3s and 4s. She's in a lot of pain. She's uncomfortable. I'm going to keep her right at the edge of the mold, make her relax, just to get nutrition to the joint. Don't test the barriers at all. Okay? All right. Also, we can do an inferior glide and we can do a distraction. The way you stabilize for an inferior glide is you basically come into the armpit and wrap around the sides of the rib cage. All right, at the inferior aspect of the glenoid fossa. And that's a 4. Okay. A 1 is right here. 2. Very comfortable, right? You can do these with oscillations. I'm still maintaining my loose back position of the shoulder, even though I don't have it propped up. Okay. Now, so easy. Inferior glide. Stabilize. You do it this way to make your body more rich. Just good glide. Okay. All right. Let's look at her shoulder. See what this range looks like. Probably 160, 170. She got her 90 plus on external. Normal internal, 90 plus. Abduction 180 plus. Okay. Does that bother you at all? Okay. All right, so what do we say to improve, if we want to make flexion look different from that? What kind of glide would I do? Posterior glide. Okay. So I'm going to do a few grades 3, 4 on her for 10 seconds or better. Realign the collagen fibers. You need to hold your stretches around 10 seconds or so, okay? All right, so we're going to try this again. I want to see if it feels different. Okay, so kind of keep in mind the quality of what you felt, the nature of what you felt. And also you guys keep in mind as to how far it looked like she went, okay?
Right?
Yeah.
why you don't want to keep it there for a long period of time for the patients. Okay. Now, breathe. You can actually use distractions. Distractions is perpendicular force, and they are used generally for pain or range of motion, not specifically for one direction or another, okay? Just general. I'm about to write
So
it.
if you have a capsule, if you have like a capsule pattern, you do distraction. If you have a capsule pattern, you do like distraction to kind of like increase.
Can be used for everything, but not specifically. If it's a capsular pattern, you want to look at what your restriction is. You have to go for whatever the restriction is. That's specific glide purely to restore it, but you can use general distractions to complement it.
Okay, I thought capsule was like all directions or something, and all different movement things.
Read your notes. What did I say capsular patterns are? It's not necessarily all directions, depending on the joint, right? Specifically.
Okay,
All right?
that's fine.
Did you record that, Chris?
That's fine.
Okay. All right.
Oh, funny looking machine.
All right, basically, I'm popping the ball out of the socket. Just a little bit, though. I'm doing this. Okay.
Ooh.
And all I'm doing is using my body weight to create a distraction. This is not something you want to just go in and throw your butt out there. You want to feel where the anatomical ends are, which is right there. And this one shouldn't be terribly painful. Distractions usually are comfortable. You can pad the belts even more if you have like a washcloth or something. You plenty hand towels. You have to put your butt in them and use a little rhythm on that one. Guys may not like that. All right. Now, you may be sore after these if you take them to fours. It's okay. You'll be all right.
Breathe. Yeah.
She's a fairly healthy subject, and I didn't work really hard. So.
You fix me.
All right, let me show you posterior
And I gotta
glide
do the other
from
side.
a prone perspective. So go on your belly, and I'll work on your other shoulder. Bring me your arm. You right? Do I need to change subjects?
Oh, no, what's on?
Gotta even
Now.
out now.
What I'd advise her to do is take her hand and put it underneath her forehead, keep her spine neutral. This is with everything you do. You want to keep your patients as comfortable as possible. I would also take her below. Make sure her spine is not in a closed packed position and put it underneath her midsection. So lift your waist for me. So she has a little bit of flexion and she'll feel a little bit more comfortable. Okay? All right, now bring your arm out to me. And again, if we think about the position, some of what we, is that the way I told you to put your arm? See, patients will do that, what they want. Put your other hand on your side. Okay, so again, consider the neck and all things. So look straight down for me.